county support for everything that's happening. In addition to that, I want to thank our task force that created the plan that will be released later today. The task force is made of Krista Begg, Benefits Director for Knox County, Kathy Brown, Associate Professor and Master of Public Health Program Director, University of Tennessee, Chris Caldwell, Senior Director of Finance and Deputy Chief of Staff, Knox County, Catherine Killen, Deputy Senior Director of Strategy, Knox County Health Department, Dave Miller, President of the East Region First Horizon Bank, Mike Odom, President and CEO of the Knoxville Chamber, Ryan Steffi, Managing Partner, Sono Taco Restaurant, and Stephanie Welch, Chief of Economic and Community Development and Deputy Mayor to Mayor Kincannon. Additionally, I'd like to thank my Knox County team members, Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness, and Michelle Moyers, Director of Community Health, for their tireless work to create this document to allow our community to begin reopening. And with that, I will turn it over to Mayor Kincannon.
Thank you, Dr. Buchanan. Back in March, we acted early and decisively to close things down, an unprecedented, painful, but necessary step to slow the spread of the virus, to buy time so we, hospitals, social service organizations, first responders, and everyday people could adjust, coordinate, and plan. We had PPE drives, we increased testing, we bolstered contact tracing, our hospitals created a surge plan. We learned what physical distancing means, and we practice it. We learned how to make masks, and we wear them in places where we cannot be 6 feet apart. We learned how to Zoom. While many learned ways to work from home, we also renewed our appreciation for the many people who support essential businesses, healthcare workers, first responders, truckers, farmers, grocery store workers. Most importantly, we flattened the curve. Like many of you, I've also learned a lot about COVID-19, about epidemiology, about why it's good that Knoxville's R0 is less than 1. I've also learned that we have an amazing health department filled with actual experts who do this work all the time. The scale of this pandemic challenge is unprecedented, but they know what they're doing. The phased reopening plan Dr. Buchanan is going to describe to you in a few minutes is based on data, grounded in public health principles, and informed by business leaders. It has metrics that tell us when it's safe to move forward, when to pause, and when we need to go back. The plan is a careful, measured way to adapt the economy to a new normal until we have a vaccine. I've taken a little time to study effective crisis management, historic examples as well as places where the COVID-19 response has been effective. What works is this: brutal honesty, frequent and clear communication, a unified approach, realistic hope, and this is what we are doing in Knoxville, and it is working. I want to thank everyone who has worked so hard to flatten the curve. Now is the time to consolidate those gains and to remain vigilant. To borrow a phrase from a great crisis leader, now is not the end of this fight. It is not even the beginning of the end, but it is perhaps the end of the beginning. Thank you.
I'd like to thank Dr. Buchanan and her team at the Knox County Health Department, Mayor Kincannon and her team, as well as the City-County Joint Task Force that developed this phased reopening plan that we're here to talk about today. It's not an exaggeration to say that this is one of the biggest crises in our history. I don't think that there is anyone who has not suffered in one way or another. My heart goes out to the victims of COVID-19 and to their loved ones. My heart also goes out to the 400,000 Tennesseans who have lost their jobs over the past 5 weeks. Many of our small businesses, the backbone of our economy, have shuttered. Some of them will never reopen. COVID-19 has taken lives, and COVID-19 has ruined lives, leaving many of our neighbors without jobs, without a way to provide for their family, and without hope. The economic destruction this crisis has caused is going to be with us for a long time. We have been knocked down hard, but we have to get back up. We don't have a choice. We have to. It won't be easy, but we're going to do it. Together, we will do it. As we all know, last Thursday, Governor Lee announced amendments to his executive order allowing certain businesses to open earlier than previously planned. I very much would in Knox County follow suit, but the Joint Task Force was not comfortable in doing so because they needed more time to implement important components of this plan, such as creating teams that can work with businesses to more easily adhere to the guidelines. So as ready as I was to pull the trigger, the last thing that we needed was to inject more uncertainty and confusion into an already tumultuous and chaotic business environment. Fire, ready, aim is not a good strategy. Here in Knox County, we are going to be more thoughtful and more deliberate. Hopefully, this will help businesses more easily navigate a changed environment and give them a greater chance at success. In addition to ensuring public health, we want to minimize confusion and uncertainty so that we can provide ample opportunity for a smooth transition as we get back to work. And that's already paying dividends. For instance, because of the work of the Joint Task Force, in this plan, salons and other personal service businesses will be able to open weeks ahead of the rest of the state. We all want this plan to succeed, but ultimately it is up to us as individuals, organizations, and businesses to make that happen. So even as we begin the process of getting back to work, we must continue to exercise personal responsibility to keep ourselves, our families, and our community safe. Now, you all should have gotten a copy of the plan, and it will be posted online shortly. And now I'd like to invite Dr. Buchanan back up so that she can go into more detail about phase one. Thank you.
Good morning again. So just as a matter of housekeeping, the Mayor Jacobs mentioned the change in the governor's orders, and so in that change, the 6 metropolitan health departments are allowed to do something different than the state. And in that interest, I have written an order that keeps us with the safer at home standard until the 30th of April, as was previously planned. So nothing changes until the 1st of May here in Knox County. And Mayor Jacobs is right. We needed time to plan, get things in place, and have better support for our business community and for other organizations before we made the change. You know, when we went into the shutdown, we didn't do a great job of that, I don't think, and we learned from that. So we're trying to do a better job of that as a community. It's not just as the health department, but as a community. So that order has been written and will be available online this afternoon. So on to what you really want to know about what's in the plan. One note on what's not in the plan. The plan is not a return to normal before the pandemic. We have a new normal now. This is our next new normal. We're having to adjust to a lot of changes. We're asking our citizens and our businesses and our community at large to make many adjustments, and we'll continue to do that. But again, it's really not just going back to business as usual before the pandemic. It's kind of like a major rock slide on I-40. Okay, kind of like a major rock slide on I-40. And so now we've moved some debris out of the way, and we have one lane for both east and westbound traffic. It's going to be slow, but we encourage patience because we'll eventually get there where we eventually have full flow of traffic both ways. But right now, we've got to take our time, make it safe for the drivers on the road and the workers on the road. So if you can keep that in mind and have the patience that it's going to take us a little while to get all that out of there and get us back to kind of normal business and things as usual. And so just like any job, this has phases. We have 3 phases in our plan. And we'll talk a little bit more about those here in a minute. Each of those phases allows a relaxing of restrictions and a slow return to normal. During each phase, there will be guidance for individuals, businesses, and organizations. During each phase, we will need to follow in the order of, during each phase, we will need to do certain things in order to successfully move to the next phase. And some of those things are things we're doing now. I look out there and I see some of you wearing masks. It's one of the things we're going to need to keep doing, wearing masks when we can't maintain 6 feet of social distance. COVID-19 is not gone. It's still here. You still need to wear a mask. You still need to stay home if you're sick. You still need to wash your hands regularly and clean surfaces regularly. So all of those things will need to. Okay, I'll need a chair to do that. Sorry. I'm not even that tall. This won't make me much shorter. I know, exactly. Is that better? Is it all these mics? I'm sorry to be so direct, but help me. This mic?
You can try.
Is that better? Is that going to help?
We were getting complaints.
Okay.
That the audio stream wasn't picking up.
Okay. I'll do my best. Sorry about that, everybody. So anyway, we're going to still have to keep doing those 5 things. Practice personal distancing, using cloth face masks, washing your hands, sanitizing surfaces, and staying home if you're ill or in quarantine or isolation. Individuals and businesses alike have to look at the plan and decide, based on the guidance and their own risks, how they will implement the recommendations. For some groups, like higher risk individuals, during phase 1, we are recommending you continue to stay at home due to your risk of complications from COVID-19 as much as possible. Because of risk, we are not opening large venues for group gatherings, again, based on risk. It is important to note that if you were operating under the safer at home order, you will continue to operate with some relaxation of the recommendations to the next new normal and continue some of the old practices as well, like working and meeting remotely as long as possible. This plan, again, is phased. Each phase is building on the other. How will we decide to move to the next phase? How do we decide to move to this phase? We, public health, look at data and use data to make decisions about when to reopen a nursing home when there's been an outbreak, when to let people go back to a restaurant if there's been an outbreak related to that restaurant. Similarly, we looked at data just on a much larger scale to make the decision about when to move to this phase and when to move to the next phase. One of those pieces of data is a sustained reduction or stability in our case numbers. Those of you who've been watching, you know that our case numbers have just kind of trickled in. That's great. We've been doing that for weeks. So we feel comfortable that that's stable. We do expect that to change when we move into phase 1. Community-wide and sustained or increasing diagnostic testing with consistent or hopefully decreasing test turnaround time. We've seen the sustained numbers of tests being available. We have that happening. I know we're getting our test results back just a little bit faster, on average about 5 days. We'd like that to be less time. Not slower, less time, but that's happened. We've seen that in our community. A sustained or increased public health capability to rapidly interview new cases, identify close contacts, and ensure that isolation and quarantine are in effect. This first period has allowed my staff to build a plan, test that plan, and know that we can scale that up to address new cases. So we feel confident that we can do that, and we'll continue to watch that and scale that up. Our healthcare system has been able to create a surge plan, come together as a community and create a surge plan, get their plans in place to reserve PPE or preserve PPE, and get staff up as needed. They've canceled elective surgeries to allow for space. So all of those things have happened, so now we can move to the next phase. We'll keep an eye on those things going forward as well. And then another one, which sadly sustained or decreased COVID-19 related deaths. Deaths from an illness show us not just burden of disease, but severity of disease. And as we know, we've had 4 deaths, unfortunately, from COVID-19 in Knox County. That number may go up, but we'll be watching that number as well. So these are kind of standard things we look at: preparedness, case counts, deaths from any illness, to be able to decide what to do next in public health. Each phase will last at least 28 days. That's based on the incubation period of COVID-19. It's 14 days. If we were to move too quickly and just have a phase that's only 2 weeks long, over the next 2 weeks we might see some cases that are late to evolve. So we want to give ourselves enough time to see what was the impact of the change we made, what were the things that worked, what do we need to back off on. And we'll also probably make some mid-phase adjustments. We're not going to just put this in place and walk away. We're going to put this in place and continue to look at the data, share that information with our leadership, with the business community, and get input and make changes as needed. One thing that we believe that will help everyone in transitioning to this next phase is a recommendation to appoint a COVID-19 coordinator who will be the lead for each site or each organization. We plan to make available information to coordinators via email, a call center, and virtual training. So we want somebody that's the main contact that can help guide your organization with these changes, and we want to provide resources for that person or persons so that they can have the information they need to guide your organization. Many of you will have questions. Please review the plan closely, which will be available on the website later today. Since the Knox County Health Department cannot possibly sign off on every organization or business's plan, or even provide individual feedback to every organization, we are building a multi-agency team to help answer questions. Communicating the details in the plan to every business and organization in the entire county is quite an undertaking. More information about how you can get additional information and how your questions can be answered will also be available on the website. Please be patient with us and our multi-agency team as we anticipate the volume of questions to be high. Finally, I want to thank all of you and our community for working with us to get us to where we are today, to get us to where we can move to a new phase in our response to COVID-19. We still have a long way to go before we are fully open, before we fully open the road of our economy. But I'm confident with your support, we will get there together. Thank you, and I'll open it up for questions.
Dr. Buchanan, you mentioned this plan for phases, for adjustments that may need to be made. If we see a case spike that is beyond what you might normally expect for a reopening of businesses, is that one of the impetuses for a mid-phase adjustment that you've been talking about, and what might that look like?
Sure. So the question is, if we see a case spike, might that be a reason to make a mid-phase adjustment? And of course, it might. I think first what we have to acknowledge is that we have to look closely at that spike. Is that spike because of a cluster of cases in one location where we've been able to contact all of those people, get them in isolation, get them in quarantine, and we know that that's not an indicator of community spread. So it's not just looking at a number, it's looking at that number in the context of how it occurred. So that's why it'll be my team looking at those things and advising our leadership on what to do next or how to manage that. It might be that we see that, what we find something in common with the new cases. So we just need to address that thing, whatever that might be. So I think it's not one number, and it's within the context of how that occurred will be what will help guide us in what we do next.
Two questions, Dr. B. You talked about Saturday's response to free testing that was
Sure. So the question was about Saturday's event. We had a drive-through COVID-19 testing event in East Knoxville on Saturday. I'm happy to report that we tested over 300 people on Saturday who came through that drive-through event. And I'm also happy to report at this time we have adequate supplies to do testing through this week. We'll be testing on Tuesday, Wednesday, and Thursday. I think I can't remember the exact hours. It's not all day long. At our EPW site, with our Engineering and Public Works site, again, that's a drive-through testing site that people have to make appointments for. We feel comfortable that we have adequate supplies for this week. And as I keep saying, we keep looking for different options for supplies each day. Oh, sorry, we tested over 500 people on Saturday. Okay.
A lot of immunocompromised people are afraid to go back to work when things start to reopen. What would be your advice to them?
Well, I think, again, it goes back to that individual responsibility and understanding your own personal risk and possibly having a conversation with your physician. We're encouraging business owners to allow folks like that to be able to work from home if that's possible, to make that a longer-term solution for them. But we also encourage folks who are higher risk to really look at their own personal risk and make a decision about what's best for them.
Question for the mayor is the governor explained his plans over the weekend, saying that county governments would have the ability to make decisions over cities. And you see Hamilton County, Chattanooga, that's been a clash a little bit. Did that come into play here? And so, just talk a little bit about how that's seen.
No, actually, the Knox County Health Department has purview, and they've done, sorry. Okay. Can you guys hear me? This mic thing. The Knox County Health Department has purview, and that might be what the governor was referring to. I can tell you that with this particular plan, the city and the county work together on it, along with the health department and along with businesses. I can also tell you that Mayor Kincannon and I both have something in common, and that's we are very concerned about the health of Knox Countyans, and we want to ensure that as much as we possibly can. At the same time, we both realize that we can't remain shuttered, and we have to start moving in the direction of opening things up. So, you know, we're on the same page with all that stuff, and the recommendations and orders that are coming out from the health department, of course, with our input. Mayor Kincannon.
I agree with Mayor Jacobs. We're on the same page. The governor has said that the Public Health Department in Knox County is the authority on public health issues. Dr. Buchanan and her team have done excellent work along with this task force. They have my confidence. I've been following along their work very closely, and every day I grow more confident in their transparency of data on the website and the work that they've done to make sure that our community members are safe. And I applaud their efforts and applaud Mayor Jacobs for working together with the city. And I know that both the city and the county mayors stand behind Dr. Buchanan, and will do everything in our power to support the efforts to keep our community safe and also to help our economy reopen in a safe way so we can establish this new normal. So that's where we stand. I think the governor is in alignment and letting our Knox County Health Department lead us together. We're unified, we're on the same page.
For anybody too. Going into your plan was logical from the state to city timeline-wise. How did you go about deciding which businesses need to open first? Like, how do you decide which one is, safer to go to now versus a month down the road?
So the way we made those decisions was to look at the inherent risk of that particular place. There's certain places, like for instance, we've left bars closed because the bars are designed for people to gather close together and socialize, and we really don't want that to happen. So within a restaurant, you can have table service, but with limitations, but your bar needs to be closed. They can still have bar service at the table, but not at the bar. And it's based on the risk, people gathering together, standing close together, and sharing droplets on the surface where the bartender's going to work, or with each other, either one. So similarly, looking at other things like large venues that are designed for gathering, we decided not to open those. We're leaving playgrounds closed so children don't come to, and think about going to a playground with your kids. There's no way to keep them apart from the other children. So that's how that was made, based on how we know COVID-19 is transmitted and how to protect people.
And how are y'all going to make sure,
Sure.
sorry, that this is working? Like, are they going to be punished for doing something wrong? How are you going to know that people are doing this correctly?
So, okay, how will we know this is working? Are people going to be punished? How's that going to work? So we do a lot of enforcement at the health department, and about 75% of the venues we're opening are under our purview for regulation. And we have a lot of tools in our toolbox to help people become compliant. Education is the first step. And so our first step is always to educate. And then we get a little more forceful nudging through the powers that I have as the health officer, a letter that goes out, and then other things that can happen. But usually just education. Nobody wants to be that business that, you know, has a cluster. Nobody wants to be that business. And so people are really willing and want to make this work. Yes, yes, absolutely. You're good for it.
In regards to your second question about enforcement, I think that we all have to realize the market is going to do a lot of that too. And if you see businesses that aren't doing something, or are doing something that you don't feel comfortable about and aren't doing things that they should do, I think they're going to be punished because people just aren't going to go and word's going to get out, as Dr. Buchanan said. Also, businesses had a lot of input into this plan. They had some really great ideas about things that they could do that, you know, no one else necessarily thought about because we're not in that particular business. So that's something else to consider, and really thank the businesses that, whether they, you know, provided input to me that I passed on or worked directly with the task force. It really was a community effort, not only with public health officials, but with all those businesses themselves, because they're part of our community and they want our community to be safe and healthy.
I'll just add that the business owners I've spoken to, and I've spoken to many in all different sectors, they care deeply that their customers stay healthy and that their staff stay healthy, because that's not just the right and humane thing to do, it's also good for their business. And I, for one, am not going to patronize a business until I'm confident that they are following the guidelines that are in this plan. And we're going to be able to offer signs so they can say they've read and are complying with it. And I encourage everyone else to do the same.
I had a quick, and this would be for anybody, about that individual aspect of this, because you can reopen whatever you like in whatever manner you like, but you can't make people feel safe. Is part of this plan to build confidence among the public to feel that that is okay to do this as we get deeper into the spring and summer?
So the question is about people feeling safe returning to businesses and getting back out to some activities that they haven't been doing. And the short answer is yes. Part of this plan is about helping create guidelines that encourage people that it's safer to be out. You know, requiring, in some instances, requiring masks. And if something can't be done while wearing the mask, then that service can't be offered. It's the little things like that. And the other thing is to really consider yourself and consider the people that you're interacting with to potentially be infected with COVID-19, whether they're sick or not, and taking measures appropriately. And that's why we still say we still have to wash our hands, we need to wear face coverings when we're in public. If we can't maintain social distance, we need to social distance. And most importantly, stay home if you're sick. I know we're all ready to get our hair cut or whatever it is, colored, dyed, whatever it is you do to your hair. But if you're sick, just wait a little while. And don't put your beautician or barber at risk by making that choice.
I haven't had a chance to look through this very carefully yet. What are the capacity restrictions?
So the question was, what are the capacity restrictions? The capacity restrictions are based on maintaining 6-foot distance and somewhat based on the types of activity as well. So they vary by location and by industry. But the 6-foot rule remains, acknowledging that, you know, at a restaurant you don't have 6 feet between people at a table, and acknowledging that that's part of reopening, but encouraging restaurants to have 6 feet of distance between those tables. So it does vary by industry and by activity.
So it's not going to be half capacity and whether.
So I'd encourage you to look at the plan because it varies. And so I don't want to try to get into that level of detail.
If there is a specific, something like half capacity for retail businesses, restaurants are easy because they have, specific number of seats that they're licensed for. But like for a retail business, if there is a capacity restriction, how is that determined?
Well, so there are 2 ways to limit capacity. One would be based on fire marshal occupation, which every building has that. And also to encourage, in some instances, we're encouraging fewer than 10 people to be in the facility. In some places, it's 50% of your fire marshal capacity. In some places, it's 50% of your seating capacity. So it kind of varies depending on what kind of service you are and kind of how big your business is.
I know it's hard to predict, but a lot of people are wondering, how long am I going to have to wear a mask in public? How long will I have to socially distance? Do you have an answer to that?
That's a great question, and for several more months at the least. COVID-19 continues to circulate and will continue to circulate in our community, and we all need to protect ourselves from getting sick, and those are really easy ways to protect ourselves that we know work. And so we'll have many more months of social distancing and recommendations to wear masks when you can't social distance.
Do any of these recommendations have any bearing on the University of Tennessee, which has formed its own task force about getting people back on campus, and we're coming up on a time of year when that would normally be happening?
Sure. So the question is, do these recommendations have any bearing on the University of Tennessee? The recommendations for the University of Tennessee and other similar institutions is that they follow their statewide guidance. So statewide, higher education has a plan for how to do that. So they'll be following those statewide guidances. In addition to that, there still are some executive orders from the governor that are still in place that people are going to continue to need to follow. Any other questions? Yeah. Thank you.
Thank you.
Yeah, thank you.